Stem cells have come a long way since being discovered in the late 1970s. We all know that. Dr. Hess knows that very well. In the studio for us today is Dr. Todd Malan, and he is with Regenerative Cell Medicine, and we're going to be talking about stem cell research and how it is used today. There's a history here, and Doctor, I think you're going to give it to us, because when I think stem cells, I think, of course, the fear and the controversy on the cloning aspect, and then I believe that was derailed and defunded. Bring us up to date on that.
Well, we, in the 1990s, they discovered that there were adult stem cells in your bone marrow, and that these stem cells that we all have the ability to do two certain jobs. One is they have the ability to differentiate, meaning that they can form other types of tissue. So that they could take these stem cells from the bone marrow, put them in a petri dish, and grow a bone cell, or a ligament, or a tendon cell.
So then no longer needing to harvest from an embryo? No.
Okay. Now, the issue with those types of cells, though, is they are already partially differentiated, meaning that they've already decided that they're going to go along a certain pathway. There's a slide that they have up there, and in that slide it shows that the stem cells that come from fat, which is what we're going to be talking about today, as well as the stem cells from bone marrow, have the ability to differentiate into different types of tissue. And there was a lot of excitement in the 1990s saying, well, now we can use these bone marrow cells to repair damaged heart, or to repair a damaged kidney or liver, or to grow new tendons or ligaments in someone with a damaged knee. But the problem was they were only able to harvest very small amounts of these cells from the bone marrow. So what they did is they took this small amount of cells that they were able to harvest, they put them in a petri dish again, and they did the other thing that stem cells can do, which is the ability to divide, so that 10,000 cells can become 20, can become 40, can become 80. And they found that once they had a sufficient number of cells in that petri dish to be able to provide what they thought was a good therapeutic treatment, the cells didn't have that ability to differentiate anymore. They had lost that ability through having to divide and divide and divide many, many times. So a lot of that excitement died away, and they decided, well, these bone marrow stem cells really, they can't do what we want them to do based on the technology we had at that time. There were a lot of folks that started to think about, a lot of physicians thought about, well, you know, if there's stem cells in the bone marrow, maybe there's another source that the body has. If our body really needs stem cells on a daily basis to help repair trauma and damage, then maybe there's another source. And there was a group of doctors at UCLA who found that, yes, there was a large number of stem cells in the fat. In fact, it was
I'll give a lot of my fat away.
I was going to say.
You can take all my fat. You're going to have stem cells forever.
And that's the point. There's not only was there 1,000 times as many stem cells in an ounce of fat as compared to an ounce of bone marrow, but it's easy to get the fat, and there's usually plentiful amounts of fat. Yeah. So now we had this amazing rich source of stem cells to be able to not worry about divide, divide, divide. We had them ready to be used. However, at the time, the funding just wasn't there. There was a lot of controversy regarding stem cells. The NIH was not approving studies regarding stem cells. This was in 2000, 2001. So these devices that the scientists at UCLA had come up with that would help them to extract the stem cells from the fat, they shipped these things up, and they sent them off to Japan, and the Japanese doctors first were the ones to utilize them to harvest and extract stem cells.
Do those stem cells have that ability to differentiate just like the bone marrow cells, Todd?
They do. But the whole idea of differentiation, once we started playing with the stem cells and we had plentiful amounts, we learned a lot more about stem cells than we ever had imagined. What we learned is that ability to differentiate is not really the primary goal of what stem cells do in the body naturally. So, for example, you have a patient who has a heart attack. Well, one of the reasons that person has had a heart attack is because they have poor blood flow to their heart muscle. So if the stem cells were to go in there and simply grow new heart muscle, they would still have the problem of a lack of blood flow.
It would be a Band-Aid.
Yes, it would be a Band-Aid. But what stem cells do is they go into an area and they assess what is the overall problem. And so when we inject them into the heart muscle, the first thing they do is they stop the cells from dying further. They basically take the heart muscle that's under low oxygen and they put it into a state of hibernation. Then once they've achieved that goal, then they start growing new blood vessels. Once the new blood vessels have been reestablished, then they undertake the job of repairing the heart muscle. So there's all these different, and they have a slide up now that shows all the different mechanisms involved with what stem cells really do in the human body. And the part of differentiation, which means turning from one type of cell into another type of cell, is a very small part of what they do. The big part of what they do is preventing further cell death and wound remodeling and increasing blood supply. That's where we found that stem cells really have that amazing effect.
So it's like a miniature doctor gets into the organ, diagnoses what it needs, and then it starts to triage the different things.
It sure does. And from the early studies, we learned that they were a lot smarter than we were as doctors.
Yeah, of course.
All we had to do is concentrate them and deliver them where they needed to go.
Doctors, is this the future of medicine?
I do
believe. Of traditional medicine?
I do believe that it is the future of medicine, yes. It is... It's the body's ability. It's something that our bodies already have the ability to do.
So it's aiding the body to do naturally what it's designed to do.
Yes.
Let me ask you a question. We're off the topic here, Todd, is that obviously when we have an injury, some signal goes out from the injured area to the rest of our body, whether it's the clot because I'm bleeding or whatever. Have we recognized a signal that attracts stem cells from their storage sites to go to the injured areas? In other words, is that also what we ought to be looking at, is that instead of harvesting them and re-injecting them, is there a way to augment the call for the stem cells to the injured area and we get around a lot of those problems? Anybody looked at those receptor type interactions?
That's where most of the study is focusing right now for those folks that are looking at it from the lab-based studies. Is they're saying, why worry about concentrating and moving stem cells around if we can just attract them to the area we need them? And so yes, there is some type of signal that tells the body, hey, we need help over here, and let's move those stem cells around. And you're right, we just don't understand what that signal is yet.
So until then, we're going to try to harvest and see if we can treat some of these chronic conditions.
Yep, so basically until then what we do is we take this is a little Play-Doh sample, but we take a sample of fat from anywhere in the body, and it doesn't matter what area that we remove that fat from.
I know where I want you to take them.
So we typically need about a quarter cup of fat, and then we take that fat and we process it such that we get rid of the fat cells. And I think there's a slide, one of the first slides, that shows, or actually it's the next slide, that shows the fat globules and what the fat globules look like as far as the stem cells. But the stem cells are intermixed within those globules of fat. And then there's little spaghetti strands, which they show up here on the slide, that those little spaghetti strands are the fibrin that holds everything together. And then the stem cells are those little blue things stuck in between the fat globules. And the goal is to get rid of the fat, break down the fibrin, spin all this stuff off so that what we're left with is our stem cells down in here. And it's not just stem cells, it's also the important building blocks that the stem cells need to do the job. I mean, if you think of a stem cell as a construction foreman goes to the job site and starts directing traffic, but they need tools and they need materials to be able to do that. So along with that, we have all of those building blocks, those immature endothelial cells, a lining of blood vessels, growth factors. All those things are necessary to help the stem cells achieve that task.
Let's talk about the myriad of diseases that can be cured, alleviated, improved. Do we run the gamut? Do we run everything from cosmetic to obviously heart disease?
Well, the earliest studies were done on cosmetic applications, and the reason they were done on cosmetic applications is because that's who was harvesting the fat. Doctors like myself, in this case in Japan, were removing fat cells, and they said, okay, we've got these wonderful stem cells, what do we do with it?
Doctor, hold those thoughts. We have to take a short commercial break. When we come back, more about stem cell research. You stay right there.
future of medicine may be stem cells, and with us today is Dr. Todd Malan from Scottsdale, the Regenerative Center down there, and we were talking about the use of fat cells, fat stem cells, and Todd's about to tell us that they've finished studies that say it's safe, and now we're about to embark on studies to see if they're effective in certain treatments. Can you give us some more details, Todd?
Yes. There are many different disease processes which we are looking at from a safety standpoint, meaning can we safely remove the fat, concentrate these stem cells, and deliver them to the area where they're going to provide the most good. And most of our studies right now in the United States are currently focusing just on the safety aspects. We are now starting to look at clinical outcomes, meaning can we actually demonstrate that the stem cells have a benefit? And those are very early. Those studies are just beginning, and those first studies are on arthritis only. As far as from a safety standpoint, we have various conditions that we're looking at: neurological disease, heart disease, lung disease. But right now, as far as outcomes, we're focusing on the arthritis.
Doctor, right now we've seen the hugest amount of successes in what types of diseases? Degenerative? Where do we see the greatest success right now?
Well, the greatest knowledge that we have from studies that have been done in other countries and then moving it towards what we're doing here in the United States.
We're always so slow.
Well, there's good reasons in some cases for that.
I agree with that, but go ahead.
is heart disease. And the heart disease studies that have been done throughout Europe have been very well done, and they have given us some very good information. Right now, with these safety trials, we are seeing a lot of amazing changes that are occurring, but it's in a variety of processes, and it's mainly processes in which the body has a need for helping to remodel or repair damaged tissue.
The doctors, help me. What can be unsafe about using your own fat cells?
Well, you know, they're processed. I'm sure certain additives are given, and again, you always want to make sure you never harm the patient. So even when they do drug studies, the first part of drug studies is it safe to take this chemical. And although we're processing our own things, they're out of the body for a particular length of time, and you're injecting it in particular areas in concentration. So safety is the big thing, and it's great to know that that's the first thing they've concentrated on. Is it safe to give you back your own stem cells in concentrated form?
Let's just go ahead, especially when it comes to cosmetics. I say let's just forge ahead here.
Well, that is an area where we have the most experience with cosmetic applications, and in those cases, we're merely concentrating the stem cells.
What are we seeing there?
Yeah, so this is an example of where we concentrate the stem cells, we put them back where they normally come from, the fat, and they help to repair tissue. So they help to grow new blood vessels, they help to fill in damage. We know that part of facial aging is a loss of volume within the face.
It's the baby fat we lose.
Yeah.
And we want to lose it when we're young, and when we get old, we want,
we want it back.
The baby fat was back.
Yeah. So we're just moving the fat back to where it belongs and adding the stem cells to help improve the survival. When we used to use plain fat in the old days, the fat didn't survive. Now we can keep the fat alive, and we can help to rejuvenate the skin. So the skin looks healthier and thicker and has a nicer glow.
That's an amazing before and after.
So these are just injections, the photos?
That's just injections.
No surgical remover or tightening up?
It's just
injections.
Like under the title of fillers, I think they call them. Or
super fillers.
Super fillers, yeah. Yeah, the other fillers would go away.
This is living filler, so it changes as you change. So as she gains weight or loses weight, that filler will change with her.
Wow.
And this is an example from a study.
Do you have an appointment? Let's see, Wednesday at... What are we looking at here?
This is an example from a study that was done in Japan who had those first devices. And this is a patient who has had radiation for treatment of ovarian cancer, and they ended up causing a burn, a radiation burn. This would not heal, and because it's overexposed bone, a skin graft would not close that area. They tried many skin grafts. This is after the after picture is after a single injection of stem cells. Completely healed, closed that tissue because it was able to grow new blood vessels, not just grow skin, but grow new blood vessels to keep the skin alive.
Fabulous.
Fascinating. We're going to have Todd back.
Yes, please. Will you come back and
I would be happy to
speak to us more? Thank you. Thank you, Doctor. Where can they find you? First of all, let's tell people where they can find you.
We're in Scottsdale, Arizona, and I believe they have the website information up there, mystemcelltherapy.com.
Excellent. Doctor, thank you so much. It was a pleasure.
Thank you.